Sopa, and this is my sterility competency video. Alright, so the first thing I'm going to do is I'm going to wash my hands. I am looking at my HCP order right now, so I'm just going to verify it. My patient is Ren Harumi. He is a male client. His date of birth is 03/03/83. His ID number is 160011180. He had a double lumen catheter anchored in place, and that was discontinued 2 days ago. Today, he spiked a fever of 101.5 degrees Fahrenheit, and I, as the RN, the RN called the physician to obtain an order for a straight catheter stat and to collect a sterile urine sample or sterile urine specimen for a culture and sensitivity. Okay, so now I'm going to gather my supplies for a straight catheter. So right here I have a catheter kit. It is a 14 French in and out catheter, and it is unopened, intact, unexpired, and sterile. Here I have my sterile gloves, and they are also intact, unopened, unexpired, and sterile. So the next thing I'm going to be doing is going into my patient's room.
I'm putting this on the top.
Hi there, my name is Kaylee. I'm going to be your student nurse today. How are you feeling?
No, I don't know why I have
Patient response. Good. Okay, so the first thing I'm going to do is I'm going to take my MAR, and I'm going to ask my patient, can you tell me your name and date of birth? He says Ren Harumi, 3383. Perfect, that matches. And then I'm just gonna ask one more time, and he says Ren Harumi, 3383. Perfect, and then I'm gonna compare my ID badge to my MAR, and it says Ren Harumi, 3383, and the ID number is 160011180. So I have verified that I have the correct patient. Okay, so now I'm going to ask my patient for his level of consciousness. Can you tell me where we are today? He says the University of Kentucky College of Nursing. And what month is it? March. Then I'm going to ask for any allergies. So do you have an allergy to betadine or to latex? He responds with no. So now I'm going to wash my hands and raise the bed.
I'll just have my roommate.
And I'm going to be raising the bed to my waist level since we will be performing a sterile procedure. I want to make sure that the bed is not below my waist because anything below my waist is contaminated.
Will you sign? I'm missing. Then will you sign?
And now I'm going to lower the bedside rail closest to me. And I didn't say this earlier, but I have provided privacy for my patient. Now I'm going to wash my hands, and I am going to put on clean gloves so that I can perform a bladder assessment. And then while I'm doing this, I'm just going to ask my patient, today we're going to be doing an in and out catheter, which means that it'll only be in for a couple minutes just so we can take some urine. Is that okay with you? He says yes. Okay, and then I'm going to ask, is it okay if I pull your sheet down? And I'm going to provide for as much privacy as possible. So now I'm going to palpate the bladder. And my expectation would be that the bladder is slightly distended. So now I'm going to percuss. And my expected finding for someone in his condition is that the percussion sound would be dull since the bladder is most likely distended. So now I'm going to take off my dirty gloves, and I'm going to wash my hands again. And now I will be performing perineal care on my patients. Okay.
to do that the first time, but Tori doing it, so
We
we'll
just
tell you.
noticed.
Thank you, I appreciate that. I would have been very.
Yeah. We just saw that.
Yeah, I'm pissed.
Okay, we only found it once, is that?
Okay, that's good.
Okay.
And I'm still here, so it's like one of you all
Yeah.
need to leave or something.
No,
I
you're
can-
fine. If you get done, neither one of us will leave, so you can, if you want to go.
Okay. So now I'm going to be pulling back the sheet. And I have my basin here. I have 2 clean washcloths and a larger clean dry towel. My basin is going to be filled with warm water. And if my patient was an uncircumcised male, I would make sure to retract the foreskin before I perform perineal care, and that foreskin would stay retracted until the catheterization and second perineal care was complete. So I'm dipping my washcloth in the warm water and putting foam soap on it. So I'm going to clean the head.
160011180. She's been admitted to the
Fold that
hospital
back.
for CHF exacerbation.
Get a new part of the towel.
Rigorous diuretic therapy that
Shaft.
strict INOs. Because of this, the physician orders
New part of the
an
towel.
catheter to a dependent drainage
And
system
the
for administering diuretics. So today I'm going to be putting in a full catheter and seeing if my patient
That is
needs
dirty.
care.
Now I'm going to do a new one with just the warm water.
My supplies.
The head. Shaft.
So I've gathered my supplies. I have 3 pairs of clean gloves. I have a
And
clean basin
the
with 3 washcloths to be put
scrotum.
here. I have a pair of
That's dirty.
non-latex, sterile
Now I'm going to
gloves
just
that are intact,
dry
open, uncontaminated,
the area.
unexpired. Have the tape.
And
then
put
I have
all
my
that
foliage
aside.
tray,
That is now
catheter kit.
contaminated.
It is
I'm going to
intact,
take
open,
my gloves off.
sterile, and unexpired. So I have all of my supplies.
And I'm going
ready
to
go.
wash my
I'm gonna
hands.
Take off my watch and take
Okay,
off my badge. just to
so
make sure I
this will
maintain
start
sterility.
the sterility part of the procedure. So
I'm ready to go into my patient's room.
I'm going to clear everything I don't
How are
need
you
off
doing
of this
today?
table.
She says good. Wash my hands again. Mrs. Harumi.
Here I have my catheter kit. We've already ensured that it is intact, unopened, sterile, and unexpired. So I'm just going to take that out, and that can go on the ground.
ID number, and she says 160011180.
And then I'm going to open my catheter kit away from me to each side,
Now I'm going to
and I'm touching only the corners and towards me.
Are you allergic to beta
Now I'm going to make sure not to reach over my sterile field at all.
Now
So I am just going to grab
assess her level of
the
consciousness.
corner of my drape,
Mrs. Harumi, I'm going to ask you a few questions. Can you tell me where we are right now? She says College of Nursing.
hold it up, and I'm not going to go over my sterile field, so I'm going to reach around
Okay, perfect. So our patient is alert and oriented times 3.
and
So
release.
we are ready to go. Now I'm going to go ahead and raise
Now
up the bed
I'm going
to a proper
to
warming
sterile
level.
So I'm pulling the flaps out, making sure I only touch the 1-inch border so as not to contaminate my sterile field. I'm grabbing just the cuff of my glove on my right hand, pulling that down as far as it goes, and then leaving it be. Now I'm going to insert 4 fingers, making sure my thumb stays far up.
So now I'm just going to go ahead and pull this out. Get ready for my assessment. I'm going to get a clean pair of gloves.
And then
to
since my
my
hand is sterile, I can fix that finger. This is gonna come off of my table. All right, so now I'm gonna keep my hands above my waist since I have sterile gloves on. So, in my kit, I have betadine, I have a urine specimen sample cup,
To palpate the bladder.
I have
Mrs. Harumi, do you have any pain?
a in and out
Pain,
catheter,
tenderness with that? She says no.
and I have my forceps. So I'm going to keep my catheter in here.
Any pain or tenderness? She
I have
says no,
lubricant,
and there was dull
and in the
sounds.
side of my container, I have
To remove my
clean,
gloves
sterile
and
cotton
start a
swabs. So the first thing I'm going to do is I'm going to take my betadine, and I'm going to cover my cotton swabs in betadine, when I
During the procedure, I'm just gonna provide privacy.
discard of anything from my sterile field, I'm going to go out, not to touch me, around, and drop it. So now I'm going to take my lubricant,
To get ready for my pericare.
open it, out and around, drop. And I'm just going to
So now I'm ready for pericare. I'm gonna get my clean basin. Okay, so I fill the basin with warm, clean
Insert
water. Put my 2 wash rags in there.
the tip of the
Keep
catheter,
them wet. So I
make
get
sure
my soap.
it gets
Put soap on the first rag.
a decent amount of
First, I would
lubricant
clean
so that it
down
can
the right
slide
side of the
in.
labia from top to bottom.
Now this is going in the trash, out and
I'm gonna
around,
get a clean
drop.
piece. And on the left side, outside of the
Okay,
labia.
so
all the
I'm
way
going
down
to
from
move
top to
this
bottom.
closer to my patient,
Get another clean
take my
piece
forceps.
and go right down the middle.
This hand, my non-dominant hand, is going to become contaminated, so I'm going to
I'm gonna get
hold the
clean
penis
rag
at a
and just
right
have water
angle
on
to
it,
the
and I'm gonna
body.
do the same thing.
I'm going to take
Get
my
on the right side,
forceps and a
top to
cotton
bottom.
swab
Get a new piece.
and clean
Left
just
side,
around the
top to
urethra,
bottom. Get a new piece.
out and around, drop.
And right down the middle. And I would discard
Second
this.
one,
And then finally, I would just take my
a little further
dry
down.
rag and hot dry.
out and around, drop. And a last
So
one.
I'm done with my pericare supplies. I'm just gonna put them to
Out and
the
around,
side.
and drop both the cotton swab and the
I've
forceps.
removed my gloves and discarded
Now I
them.
am continuing to hold the penis, and next I will be inserting the catheter. So I am
Okay,
going
Mrs.
to
Reed, are you
instruct
ready?
my
I'm gonna do your
patient to
Foley.
take deep breaths while I perform the catheterization. I am holding 2
So, I'm
inches
maintaining
away from the
privacy
tip
whole
of the
time, have
catheter,
covers pulled back.
and I'm going to insert 5 to 7 inches, and at that point I should start to see urine flow. So I'm not touching anything, going straight in, and we're gonna thread that through,
So I've washed my
and
hands,
I'm going
and I
to
double check.
clamp
This is intact, unopened,
the-
sterile, and unexpired.
penis and the catheter.
Now this is going to be
So
my
now
trash.
I'm going to unpinch and allow a little bit of that urine to drain into the basin, and then I'm going to pinch it off again.
Open this, undo
That
this.
allows the dirty urine to come out before the specimen cup.
I'm gonna rearrange that.
And then I'm going to unpinch,
From the top.
allow the specimen cup to fill while still holding the catheter in place.
Ugh, what is wrong with
Pinch it.
Oh my
You got
god.
it upside down.
Ugh.
Okay.
I was like, why won't
Tap
this
the
open?
cup, set that aside,
I didn't realize at first it was on.
and allow the rest of the bladder to
I was
drain
scared to, like, touch it.
while continuing to hold the catheter in place but not clamping it off.
It was on a roll. I felt
Then I'm going to set that aside so that I can document what the urine looks like. And then I'm going to
Whenever you take
carefully unclamp and pull the catheter out. Now my field is no longer sterile, so I'm going to clean that up. And discard of that. Discard my sterile gloves.
If I say the name Hillary one more time.
Okay. And then I'm gonna ask my patient how he's feeling. He responds that he's feeling good. Oh, I'm not gonna cover that yet. Now I'm going to wash my hands. And at this point, I would put on a clean pair of gloves. I would perform pericare exactly the same way I did in the beginning. And if my patient was uncircumcised, I would, at this point, replace the foreskin. I am going to now cover my patient. And I'm going to pull the bed rail up and allow him to go down. And I don't know if I said this, but after I did pericare, I would take off my gloves and wash my hands. Okay, and then the last thing I would do is I would come to my urine collection and I would document it. So today is March 12th, 2020. And it is 4 o'clock p.m. I put in a 14 French in and out catheter. The urine sample came out a clear, pale yellow. There was a moderate amount of urine. The patient was able to tolerate the procedure. And the specimen was collected. For a fever spike after 2 days of discontinuing a double lumen catheter. So now I have documented. I'm going to wash my hands again, and I would put on gloves and take the sample to the lab.